guys, welcome back to my channel. This is Angel, the Psych MP via the Mentaldemic, and today we are going to talk about depression. On this channel, I talk about current events of mental health issues that are happening in the world today, as well as self-care, mental health awareness, and all things dealing with us just being more whole physically and mentally. We've been doing a lot of talking about suicide on my current event Tuesdays, so I wanted to kind of bring a video to you about the number one cause of leading to suicide, which is depression. Those thoughts of depression and feeling that pain, they end up coming to a point where they just want to end it all. So depression is the leading cause that's leading up to suicide. As practitioners, we use a book called the DSM-5 to diagnose depression. Unlike the medical field where you use labs or blood work, or you use x-rays or MRIs and things along those lines to come up with a diagnosis, we don't really have that. A lot of doctors have done some research out there that basically deals with how people who have depression, anxiety, like different parts of their brains are affected. But overall, the DSM-5, we use basically symptoms of what a person is experiencing, for how long those symptoms last, and other things that accompany those symptoms to come up with a diagnosis. For depression, the DSM-5 has nine symptoms that they use to diagnose depression, as well as at least 5 of those symptoms have to be present for at least 2 weeks. All of the symptoms nonstop. Not like one day you're feeling down, then the next day you up and you out, and then the next day you're not eating, and the next day. It has to be for 2 weeks, at least 5 of the 9 symptoms consistently happening for you over the 2-week period. And then along with 4 other factors that we use to come up with a diagnosis of depression. So I am going to go through those 9 symptoms of depression. And if you or anybody you knows has at least 5 of those and it's been happening for 2 weeks, we can kind of give, you can't diagnose it and they shouldn't diagnose themselves. They should go see a practitioner, but it's just a marker that you can say, okay, maybe I need to go take this person or take myself to see somebody. One of the first symptoms is a depressed mood. A depressed mood could be just, feeling down, hopeless, down and out and hopeless. That's number 1. Number 2, it can be a loss of interest or pleasure in things that you normally would enjoy doing. You just no longer enjoy doing those things anymore. Number 3, it could be a weight loss or weight gain. We've all probably been there before, maybe with a breakup or, something with your boyfriend or girlfriend. Some people eat a lot when they're sad, and some people don't eat at all when they're sad. So weight loss or weight gain could be a sign of the depression. Insomnia, being able to, being up all night, being unable to sleep could be a sign of depression. Psychomotor agitation, those are things that sometimes are observed by other people that you may not necessarily notice that you're doing. Maybe things with your hands or things with your mouth, different things that are like happening with your body that you may not be aware of could be a sign of depression. Fatigue. This is a big one because a lot of people in the lay world who just, when they think of depression, they think of people just laying down in the bed, not wanting to get out of bed. And they're right. Extreme fatigue, just wanting to sleep all day, or just not even necessarily sleep, just don't feel like doing anything because you're just so tired, could be a sign of depression. Feeling worthless or extreme inappropriate guilt about things. Maybe if someone passed away and you felt like you could have done something different, and which we all know that we can't. That guilt could lead into depression or hopelessness. Like maybe things aren't going right in your life as you may feel, or you have a timeline on your life for certain things to happen and you're not meeting and you start to feel hopeless. That can lead you into depression. Decreased concentration, being unable to make decisions about stuff, or being able to not focus. If you were able to sit down and watch a whole TV show at one time before and you can't do it anymore because you just can't concentrate or focus on it, that could be a sign of depression. And then the thoughts of death and suicide is definitely a main one, because that's the one that the ultimate one that we do not want people who are depressed to end up in. Thoughts of death could be, maybe you're just thinking that, oh, people will be better off without me here, or the world will be better off without me, and actually thinking of like suicide. Thoughts of death and suicide could be different. You could be thinking, oh, like something's going to happen to you, or if you go outside, you may get hit by a car. Those are like thoughts of death. Thoughts of suicide comes off different, because now you're thinking about what you're going to do to yourself. And there's different, there's a passive suicide and there's the active suicide. The passive suicide will be somebody, saying that, oh, if I get hit by this car, I'll be okay. If I die, nobody will miss me. That's like a passive thought of suicide or death. But an active one will be having a plan. Today, on this day, I am going to do this. That's an active plan, because you know what you're going to do, how you're going to do it, when you're going to do it. That's an active plan for suicide. And in those times, that's an extreme emergency. We need to call 911. We need to take patients or yourself to a crisis facility. We need help. This is something that you can't deal with on your own. You need help. In my opinion, if I have someone that's saying that they actually even have that passive thought, I want them to go get help, because the passive thought can lead to the active thought if left untreated. Now, those are the 9 symptoms. With those 9 symptoms, you should have 5 of those happening for at least 2 weeks straight before you can say you're depressed. But outside of those, you will also should have 5 symptoms that you have on these 2 weeks. They're causing you to not be able to go to work or not be able to go to school. It's affecting your daily living or your quality of life. The episodes are not attributed to something else, like a medical condition, like if you have cancer or if you have substance abuse or something like those. The episode of the depressions are not better explained by any other mental health disorder that's like serious, like a schizoaffective disorder, schizophrenia, and no previous history of like any manic or hypomanic episodes of depression. To be diagnosed with depression, you must have 5 of the 9 symptoms according to the DSM-5 of depression, as well as the symptoms should be lasting at least 2 weeks long, and all 5 symptoms need to be present, or a variety of the 9 symptoms, but you should have at least 5 of those symptoms going on daily for the duration of the 2 weeks, as well as symptoms should not be attributed to any other medical condition. Out of the 9 symptoms, at least 1 or 2 of these must be present. The depressed mood and or the loss of interest in things that you normally like to do need to be present out of the 5 symptoms. So if you have 5 symptoms of depression, of the 9, at least 1 or 2 of them has to be a depressed mood and or the loss of interest in things that you normally would like to do. Work, school, going out, happy hour, whatever it may be. As practitioners, we use that DSM-5 criteria to come up with an official diagnosis of depression. Again, this video is not for you to diagnose yourself or diagnose anyone else, but it's a marker for you to be able to recognize symptoms in yourself or someone else so that you can get help. Because I'm a firm believer of a lot of things that are happening in the world with mental health is lack of knowledge and education on it. I do think that the world is opening up a little bit more to it, but we're still so far away. Again, if you have 5 of the 9 symptoms that I mentioned in this video, as well as you had those symptoms for at least 2 weeks, at least 1 and or 2 of the symptoms has to be a depressed mood, as well as a loss of interest and pleasure in things that you normally would like to do. Depression is not related to anything medical or any other mental health disorder, like you're schizophrenic or you have schizoaffective disorder or anything like that. So guys, pay attention, be aware, take care of yourselves, be in tune with what's happening in your mind and your body, as well as the people around you, because we have a social responsibility, I believe, in this day and age to just look out for one another. It's so much going on, and everybody is just not equipped. So if we can, if we have the resources or we're equipped, we should be looking out for other people. Like, subscribe, turn on your notification. This is Angel, the Psych MP, via the Mentaldemic. Ciao. Oh,